A prosperous new year in advance to everyone. Welcome to your favorite program, Health Affair, where we discuss critical health challenges with a view to finding lasting solutions. I am your host, Oshuomowa Daniels. Nigerians on the 25th of December 2020 woke up to an alarming figure of 1,041 confirmed cases of COVID-19. The figures have continued to fluctuate between 700 to 1,000 plus in the last few weeks, yet many Nigerians are still in doubt of the reality of a second wave. The reason for this situation and all the necessary facts that people need to work with is the focus of our program today. Let's begin with our news segment.
Our first port of call on Christmas Day was the St. Anthony Catholic Church.
Let this Christmas touch their hearts. They are getting confused, and it's a pity. Whatever happens overseas, they copy it here. They copy it here, hook, line, and sinker. But good things over there, they can never copy. If COVID is there, I don't know, but I'm not a medical practitioner. I've never seen any human being that has COVID. I'm not denying the fact, though, but let them try to be open and transparent so that people can believe whatever they say. If COVID is in Nigeria, well and good, God has been protecting us. We need to help ourselves and protect each other and protect ourselves. Take the necessary precaution. The government should face it as it is. They should know how to assist people. The greatest COVID in Nigeria today is hunger, starvation. The greatest COVID in Nigeria today is the fact that people are not free in their own God-given country.
Our crew went further to monitor the celebration around the Lagos metropolis.
Because of the peculiarity of COVID-19, we needed to do away with gathering of people in a place, but that has not actually disturbed the celebration that we are doing. So that's why we are having it a low key. This season, the Lord gave us a scripture in Isaiah chapter number 9 verse 6 that a son is given and a child is given unto us. So that son has the government of all the nations, including Nigeria, on his shoulder to take care. So Nigeria in the hands of God. God will take care of this country. The future of Nigeria is bright. We cannot have faith and deny the existence of a virus that is killing people, and we want to gather. Why? I believe that if you're a Christian, if you're a pastor, if you disbelieve COVID-19 issues and you want to gather people, you are not only disobeying the law of the land, you are actually disobeying the law of Christ. Because if Christ will pay his dues, if Christ will say, give unto Caesar that which is Caesar, I don't know what you are doing. I don't know why I would want to go against those words. So my advice is this. It's very simple. Faith is your ability to identify and appreciate there is a challenge, but that we can, under a strict rules and regulation, guidelines, principles, we can go against this Goliath, we can go against this Pharaoh, and at the end of the day, we'll be free.
There's always a trying period, even in our personal life. So when it now comes to the nation as a whole, we will all pass through it and we'll come out together with joy.
Some frontline health workers there at the Yaba Infectious Disease Hospital enjoying the Christmas celebration and end of year 2020, which was designated as a global year of nurses by the World Health Organization, WHO.
Nigerian North American Nurses Association coming down to say we need to appreciate the frontline workers. It's something that we should appreciate, we should commend. We're in an environment that, whether conducive or not conducive, they have to work.
However, worried about the record of 1,041 COVID-19 cases that Nigerians woke up to on Christmas Day, with Lagos leading 22 other states with a scaring figure of 316.
Go around here, we have like 30-something patients of COVID-19 cases here now, right now. So we are having another wave.
Nigerians should They should stop saying there's no COVID and abide by the basic rule: social distancing, use your face mask, regular hand washing, and make sure you eat healthy meal that will boost your immunity.
To further equip the frontline workers in the battle against the second wave of the pandemic, the health workers called for more provision of personal protective equipment, PPEs, and international support in terms of training. From scientific observation, a virus must change its envelope or outer surface to avoid being recognized by the antibodies and immune cells. This is the case with a new variant of the COVID-19 infection that has been reported across Europe and Africa.
So far, we've identified a handful of variants, or what we call mutations, as you've heard, in the United Kingdom, in South Africa, and even here in Nigeria, we've identified mutants. But there is very little evidence that these mutated coronaviruses, Corona-19 viruses, are behaving in any way very different from the parent. So the mutation hasn't caused a major shift in the way the virus is behaving. There is a suggestion that it is slightly more contagious in the UK scenario, but we haven't observed that here. And we certainly haven't observed that the virus is more dangerous.
With a record of 28,774 confirmed cases and 236 deaths as at the time of this report, the Lagos State government is worried that without necessary cooperation from the residents, the situation could get out of hand.
We must keep our guard up. We must be astutely aware of the guidelines that the government is publishing, and we must try and follow them.
The state government has also acknowledged the falsification of COVID-19 test results by some air travelers. Apart from an upscale in testing capacity, the government has also started building oxygen centers across the areas to manage critical cases of COVID-19.
Lots of people are presenting with shortness of breath. They can't breathe properly. And by the time they get to a private hospital or some other place, they will be left outside. They will not have access to oxygen. Some of them get very sick, and before they get to us, they die. It is a COVID oxygen facility. Anybody who needs oxygen, who is short of breath, can't breathe properly because of COVID, we will stabilize them here, start the treatment, monitor them.
Welcome back. Some countries abroad are on a lockdown, battling with the second and even the third wave of the COVID-19 pandemic, with an increasing death toll. Here in Nigeria, many people are still in doubt about the existence of the pandemic. They disregard the daily figures churned out by the Nigerian Center for Disease Control, NCDC, and demand for evidence every now and then. Despite the reintroduction of preventive guidelines by the federal and state governments banning large gatherings, I observed how some people threw caution to the wind in some places our crew visited during the Christmas celebration. In an effort to unravel the true situation about this pandemic, I spoke with an infectious disease specialist, a public health advocate who worked with scientists that discovered Ebola and designed the algorithms for the diagnosis and treatment of HIV/AIDS, Dr. Joseph Onigbinde. Dr. Onigbinde holds a lot of master's degrees and PhD in public health and infectious disease control from the New York University and other foreign institutions. Dr. Onigbinde will be telling us what differentiates the first wave from the second wave of the pandemic, with evidence of close associates that have been infected, details about the new vaccine, and lots more.
One of the problems you have when you have the first wave, the second wave is usually more serious, because the second wave is usually about because people let down their guards. They say, oh, we have overcome the disease. Whereas if you don't have a vaccine, especially preventive vaccine or curative vaccine, you have not overcome any disease. And usually the second wave is more serious than the first wave.
What makes it more serious? Why is it? We hear that it's more deadly. What differentiates it from the first?
What makes it more deadly is because the virus itself has not stopped fighting, but you have let down your guards. And in some cases, there are also mutation. The virus itself gets mutated, like in HIV, and in this case we also have some mutant strains. So we understand that in the UK now you have more virulent virus. So second phase usually, see, when you are fighting with your opponent and your opponent has not stopped fighting and you are relaxing, the tendency for the opponent to overwhelm you and develop new strategies. He has known how you box, so you develop new strategies and you can no longer cope with your tactics before. So second wave usually in epidemiology is more serious than the first wave. So the solution is just for us to go back and even do what we were asked to be doing before and do it more seriously.
That brings me to the issue of non-compliance. What do Nigerians are? A lot of people don't believe that there is COVID. And a lot of them, I go around the streets every day. Out of 10 people, you hardly can see like 3 people wearing nose masks. And those who even wear it, they put it on their chin.
Yes, like I am doing now.
Serious.
Yes.
So how do we get out of this situation? What's the implication of this lack of or low compliance to preventive measures?
That is a big problem, especially in this part of the world where we don't take things easy. We don't take things seriously because our government, they are not serious. All the things, wash your hands, wear face mask, all those preventive measures, they are thrown away. And that is very, very dangerous. That's very, very dangerous. Well, I think the government is now trying to clamp down on the people now, that if you don't wear face mask and all that, you are going to pay some fines. Maybe that will do some magic. Otherwise, it is very sad. People are just doing as if there's not. They will tell you, oh, there's no COVID in Nigeria. Truly, there is COVID in Nigeria. There's COVID everywhere. It is true that the virulence in Nigeria, the mortality and morbidity in Nigeria is less than you have in Europe or America due to certain factors. But you still have COVID. People that are even close to me, medical doctors, for instance, who are at the front burner. So I think we have to do something seriously about it. Otherwise, we will be in for it.
It's deadlier in the foreign countries. What makes it less?
In this area, there are many studies that have actually been carried out to find out that, well, number one, perhaps the most important thing is that our populations are younger than the populations in Europe and America. They are aging population. And we know that COVID is usually more serious in adults. People who are 50 and above or 60 and above, less severe with a younger population. So our populations are usually younger than the European populations or American population. That's number one. Number two, out of evil comes something good. We have been sad, we have been attacked over the years by infectious disease, like we've been typhoid, malaria, tuberculosis, and so on. So it has been found out from studies that these infectious diseases have actually conferred some immunity on us, which can stand the attack of COVID. So we call it transferred immunity. So that kind of protects us. Though we have suffered from infectious disease in the past, we are now being protected against COVID. Then there are other factors too, and maybe the weather that plays little or no role. Hot weather, but you still have some places in the world that are even hotter than Nigeria that are still having more attack of COVID. So I don't want to overemphasize that younger population, then they conferred immunity by those infectious diseases that we have been suffering from. Like tuberculosis, for instance, it's a gives us some immune system that are able to face COVID.
So, sir, why do you think Nigerians are not taking this thing serious? Recently, I heard that some people are even getting fake results. Those who want to travel, they fake the result and they beat the security at the airport. What is that our government is not doing right that makes you think that people don't have this confidence in them?
Yes, the people don't have confidence in Nigeria because even our government, to the lot of start from even their certificates are fake. They are false. There are a lot of things in Nigeria are not just correct, and that's why people don't take, even when the government says this, they don't take them seriously. The palliatives, for instance, that were supposed to be given to the nationalities, to populations, leaders are hoarding this thing, are keeping it to do birthday parties and to give as gifts to their friends and so on, which is very sad. So when you have leaders like that, leadership like that, people won't take you seriously. And of course, corruption has eaten deeply into our system. So that's why you see people now going for fake results, fake this COVID results, so as to travel, which is very, very bad. This is deadly. You are joking with your life.
So we should expect the vaccine every next year. This vaccine, is it preventive as well as curative? And how ready do you think we are in Nigeria to get the vaccine?
No, the vaccine is prophylactic, that's preventive. It's not curative. But good enough, we have some drugs that are active against COVID. There's a combination of them. You have like chloroquine, which is very controversial, but chloroquine is still effective. You have anticoagulants. You have some antiviral that you can use to manage. Where we run into problems when the patient has gone too far and has gone to a place where you have to put in ventilators. We don't have enough ventilators, but we have some drugs that can actually treat it. But the vaccine coming is prophylactic, essentially. It does not actually, if you already got something, it doesn't prevent you from, but only stimulates immune response within you, so that if you are going to be if you are attacked by COVID, for instance, now the virus will not have a place to sit down and start to multiply, so it is kind of inhibit the progression of the virus within the system. So, and I think by and large, though there are a lot of conspiracy theories around, but I think what we have now so far are good vaccines. Especially the one by Pfizer. Although the people say one of the nano that is like they are preparing us for the rule of Antichrist, that they are going to know everything about you, information about you, and so that is not true. So if we can get it in January, that's fantastic. Even if we get it in April, that will be fantastic, because people, we are not manufacturing the vaccines, and the vaccines are not so cheap. But the WHO has gone into some agreement that at least some people must have 20% of the population. So let's hope Nigeria will have it. If we have it, please, I will be one of the first to take it, because although people are saying that maybe you react badly to it, but from all the studies done on it, there have been no serious reactions against the vaccine.
If we don't get this vaccine as soon as possible, what do you think is the implication?
I pray that we get it. What if we get it as soon as possible? That's what you say. If you don't get it as soon as possible, it will be bad. It will be bad, because preventive measures are not adequate. I must confess to you, in Nigeria, preventive measures are not adequate. So you just need this vaccine to be able to control this population. Funding is very, very important. Without funding, you can't have good health performance, and that is a big problem. Let our people be at least serious about our health care system in Nigeria. Our officials should not just take this money and put it in their pockets. The individuals, there are some wealthy individuals that should also assist. This thing that we are going to is a very very expensive thing. I don't think government alone might be able to handle it. So individuals can come in also to partner with government to make sure that you get this vaccine and other things that can help and move our nation forward in terms of our health care delivery system.
Lagos State government has ordered workers in level 1 to 14 to work from home to think about this, and then you that lockdown.
That is that's an indirect way of having a lockdown. That's an indirect lockdown. I mean, if you say you shouldn't come to work, and I think it's good. It's positive actually. For the first time, I can see some decisions that are positive being taken, because if you avoid large gathering, that's another, because you don't have social distancing in where they are working. So I think it's positive. Let's see how that goes. Let's want to try for 1 or 2 months and see the way forward.
So as a great word from you today, what are you telling Nigerians? Those people out there who are working, not covering their nose, those who are saying that is a lie. What is your advice for them? My advice for them is, if you are saying it's a lie, you are joking with your life. COVID is real. COVID is real. It's here in Nigeria. If you are not affected, thank God. But you don't know who is carrying it. Even as doctors, we don't know who is coming. So we have to wear face masks and wear shield and all that, and gloves, because anybody, it's not written on anybody that I have COVID. So you don't know who is carrying COVID. So let us sit up and wear this. It's just for a while. I'm sure in the next 2 months or so, we should overcome this, especially if we have the vaccine. Because when you have the vaccine, then we'll not be able to do social distance and wear face mask, but it will be reduced, and that will normalize our activities by and large. So my advice is, let us partner with government. Let's support government, not only financially, but even in our attitude and attitude towards the directives by government officials, by health officials. Thank you very much.
You're welcome.
It was nice speaking with you.
Thank you, madam.
I appreciate you.
You're welcome, ma'am.
More and more people are testing positive to the coronavirus infection, and the death toll around the world is increasing. Do not believe any conspiracy theory that the coronavirus is over-exaggerated in Nigeria and is used by the government to make money.
The daily figure given by the NCDC are not just mere compilations.
Coronavirus is real. Wash your hands all the time. Sit at home.
Together, we can fight coronavirus.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant information. The sorry state of our health infrastructure has also been a major challenge. On Health Affair, Oshomoa Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through quality information.
Welcome back. Next on the program is our nutrition segment, and the focus for today is on ginger.
Ginger is a flowery plant whose root is widely used as a spice and in traditional medicines that developed over generations within various societies before the era of modern medicine. It originated from Southeast Asia and was domesticated first by the Taiwanese indigenous people. It is also planted now in South America and Africa. It was also used by ancient Greeks and Romans. India is presently the world's largest producer of ginger, with about 32% of the world's total population. Ginger is a very popular fragrant kitchen spice, juicy and fleshy, with mild pepperish taste. Ginger is used worldwide to add flavor to meals. The demand for this wonder root has been consistent throughout history. It is used in preparation of food like vegetable, beverages, and most especially meat. Raw ginger is composed of 79% water, 18% carbohydrate, 2% protein, and 1% fat. 100 gram serving of raw ginger supplies 80 calories and contains moderate amount of vitamin B6, 12% of the daily value, and dietary minerals like magnesium, 12% of daily value, manganese, 11% of daily value. apart from being used in spicing up food, it also has anti-inflammation and antioxidant properties.
Our clinical segment is where we get experts to give you vital health tips. Let's go there.
We always emphasize the need for appropriate lifestyle practices. So let Nigerians have, some remodeling and reprioritization of their health habits. So sleep enough, eat well, eat proper diets, indulge in exercises, avoid those risky behaviors like smoking, alcohol consumption.
The perception segment is open for the participation of anyone who cares about how we can work together to better the nation's health sector.
It's no longer a time to pretend. Coronavirus has made it that we are in an interdependent world. So if you're living in the comfort of your home in Banana Island, it does not mean that you're insulated from diseases, emergencies, or health crisis. So we must deliberately protect each other. Government takes the lead, sure, but private individuals, corporate organizations, we must work together to make sure that the future is guaranteed for all of us.
This is where we end the show today. Thanks for staying with us. My prayers for all our viewers is that the new year 2021 will be one of your best years on earth. My name is Oshuomowa Daniels. Please stay safe.